Dr. Mehmet Oz, made famous by Oprah and by his own daytime talk show, has been tapped by President-elect Trump to run the Centers for Medicare and Medicaid Services, the federal agency that provides health coverage to more than 160 million Americans. His Senate confirmation, however, could be rocky as they dive into his past, sometimes questionable health care claims, and his investments in privately run Medicare Advantage plans. ABC's White House correspondent MaryAlice Parks has our prime focus on Dr. Oz.
Ladies and gentlemen, we proudly welcome to the Hollywood Walk of Fame, Donald Trump.
If one thing is certain, President-elect Trump appreciates a fellow star.
Dr. Mehmet Oz.
Before ever running for office, both he and Dr. Mehmet Oz were already known to millions from their TV shows. Now, as Trump selects leaders for his incoming administration, he has paged Dr. Oz.
1, 2, 3.
Nominating him to lead the massive government agency, the Centers for Medicare and Medicaid Services. But is the doctor ready for this appointment? Once beloved as America's doctor, Oz is also controversial, blasted by members of the medical community for promoting questionable products, fad supplements, and dubious science on his show, The Dr. Oz Show, and social media.
I've got the #1 miracle in a bottle to burn your fat.
Oz is undeniably talented. He went to Harvard, then the University of Pennsylvania, receiving 2 degrees, an MD and an MBA. A best-selling author and renowned heart surgeon.
In about 3 minutes, we're going to turn the heart back on.
He climbed the ranks, becoming the vice chair of surgery at Columbia University.
Coming out, here's the man. This is his hour. Come on, Dr. Oz.
And then he burst into our living rooms with Oprah's help.
Step #1, you got to lift weights.
Then landing his own show in 2009, the health and wellness program winning 10 daytime Emmys. For more than a decade, one of the most watched TV programs. Millions of Americans turning to Dr. Oz for their medical advice.
The Dr. Oz Show helped people become better advocates for their own health.
Dr. Gregory Katz was a medical researcher on the show during its 2nd season. He said Oz treated the staff well.
He would be emailing us really late at night before an early morning taping with minute questions that I was surprised that he didn't just gloss over. And so I learned from him, he pays attention to the details.
But he admits some of the recommendations were regretful.
Not everything that we recommended on that show we should have recommended. All of those segments went through pretty careful vetting. Nothing was like scientifically inaccurate by the letter of what was said. But I think that you can argue that the spirit of some of the things that we championed was probably not the right message.
Leaders in the medical community today say that's putting it mildly.
I think the things that he said as a television doc have gotten him in trouble. Nothing wrong with being a TV doc, but when you are a TV doc giving bad information, that undermines your credibility.
In 2011, the FDA slamming Oz for false statements about arsenic levels in kids' apple juice. There were astrology segments, airtime given to well-known vaccine skeptics. At least once, a company whose products he promoted accused of having unsafe levels of lead. In 2014, Oz grilled before senators for his role in false advertising in the diet industry.
I can't figure this out, Dr. Oz. I don't get why you need to say this stuff because you know it's not true.
I'm second-guessing every word I use on the show right now. I've heard the message. I get it.
Now, Trump asking Oz to make an unconventional leap. At the helm of the Centers of Medicare and Medicaid Services, CMS, Oz would be in charge of a $1.1 trillion budget and staff of 6,000 employees. CMS central to the country's entire healthcare system. Medicare, the health insurance program for people over 65 years old. Medicaid, the federal and state-run system that provides insurance for poor and vulnerable Americans. And CHIP, the insurance program for children and families, all under the agency.
CMS is fundamentally an insurance company, and it funds half of the insurance programs in our nation. And it influences everybody's insurance because when Medicare speaks, all the other insurers listen. So, for example, if Medicare decides that a new therapy ought to be covered, that's new and innovative, most of the other insurers eventually follow suit.
For years, Dr. Oz advocated for new programs to allow all Americans to access Medicare, specifically Medicare Advantage plans managed through private insurers.
With Medicare Advantage, you can get a plan with $0 monthly premium.
which could mean lots more money in your piggy bank.
But financial records disclosed during his Pennsylvania Senate run in 2022 show that he owned $600,000 in stock in two of the largest Medicare Advantage providers. Big questions remain about what he would try to do in this role, working in a Trump administration.
I think the concern, of course, is that this is not a TV job. This is a roll up your sleeves, get in there and do serious health policy. The fact that he's never been in government and he's never run anything as big as complex certainly gives people pause.
Dr. Oz had hoped that his fame would land him in the U.S. Senate. In 2022, he received Trump's coveted endorsement and narrowly became the Republican nominee in the Pennsylvania Senate race. During that campaign, running alongside our Linsey Davis, talking about his father, a Turkish Muslim immigrant.
You know, my father was an immigrant, born on a dirt floor in a faraway land. And when he landed in America, he realized this was truly a dream. My life is a living testimony to the American dream.
There are many people who have kind of labeled you as a MAGA Republican. Would you agree with that?
I think I'm a moderate leader, but not passive. I mean, I feel very strongly about the positions I have. I want to be able to bridge a gap that has become a chasm in America, one that has paralyzed our ability to move forward as a nation.
Oz hammered by Democrats for his anti-abortion stance during that race and this answer on the debate stage, mentioning local political leaders.
I don't want the federal government involved with that at all. I want women, doctors, local political leaders, letting the democracy that's always allowed our nation to thrive to put the best ideas forward so states can decide for themselves.
Even with, or maybe because of, Trump's backing, he ultimately lost that race to Senator John Fetterman.
Do we love President Trump, Pennsylvania?
But now he's being boosted again by his relationship with the president-elect. Dr. Katz telling us his reaction when he heard that Trump had nominated Oz to join his administration.
He's going to work his ass off to figure out how to do the next job.
Oz still needs to be confirmed by the Senate, and the stakes are high for patients, families, and the entire American economy.
Healthcare costs are going through the roof. As a nation, we're going to top over $5 trillion in healthcare costs. The challenge that CMS has is to work with the rest of the Department of Health and Human Services, as well as the private sector, to get better value for our healthcare dollar. Screwing up healthcare coverage results in not just putting people's health at risk, but putting their economic well-being at risk. We cannot screw this up.
So many Americans relying on a successful healthcare system. Our thanks to MaryAlice Parks.